the Prima launched their files with a continuous movement or reciprocating movement, giving us two important and nice, good options to work with files. So I'm conducting some research in our university. These are primary results, and here you can see in a microscope view an electron scanning electron microscope view the design of the file. So it's a triangular, a convex triangular design with an active tip and a very well and very designed file to cut and to remove all the debris from the root canal. So Prima has two options. The first one, this one is the continuous tape. The Prima taper gold is to use in a rotary continuous movement, and the Prima one gold in the reciprocating motion, which I'll show you the characteristics of this file. For this kit, we have four possibilities. The files are called small, primary, medium, and large file. We have different characteristics in the tip and the taper of the file. So the first one, the small one, is used in very narrow or tiny canals. So usually we will start with the primary one, not the small one. But when we need some file or a file with different characteristics for narrow canals, we can use this small one. So it's a 0.20 file with a conicity, a taper in the body of the file. So it gives cervical and the middle of the canal preparation can perform very well. So you can see here all the root files, all the endodontic files must have their space to go. So we start with hand files, scouting the root canal, and create the space for the subsequent files, always with a solution inside the canal. So it's important. And here we can see the performance of the file, cutting in the cervical and in the middle third of the canal. It's important to understand that it's a tiny tip, so it will not clean a lot, but will open space in narrow canals. The second one, the most used one, is the primary. It's a 0.25 file with an increased taper in the middle of the file too. So it's a good file to start treatments for almost all canals. So here we can see the performance inside this plastic block. So it's cutting the resin in the middle of the canal and especially in the tip of the canal. So it's a good file to start almost all the treatments. So you can see that it cuts a lot, and you need the irrigations to remove all these debris that are inside the canal. So you have to wash a lot to remove this debris and to pass to another file. And usually we will go until the medium or the large one, depending on the characteristics, the morphology of the root canal. So the medium one is a 0.35 file. It has less increase of the taper, so it's a file to increase the diameter of the apical size, the apical area of the canal, to clean better that area, and a very interesting file to finish, to end the root canal preparations in mesial roots of mandibular molars, buccal roots of maxillary molars, and it's a very, very, very interesting file to use. So, as I told you, it will not cut so much in the middle or in the cervical third, but will increase the diameter of the tip, and this is very interesting for a final root canal preparation in some teeth that we have a curved canal. Last one is the large Prima 1 Gold. It's a 0.45 in the tip with a small increase in the taper. So it's a finishing file to increase the diameter of the apical size, the apical area in canals that we can cut a little more and clean a little more. And as you can see, sometimes the file will have a deformation, and in this case, a plastic deformation, because when we hit the file, it turn it back to original form. So it's an interesting way to see if you have a permanent deformation or a plastic deformation. And the Gutacon will fit perfectly. This is a 0.45 Gutacon, and it fits perfectly all over the root canal. And now we can fill the root canal without any problems.